and welcome to DAM's Ultimate Life Course.
Started.
Okay, so good evening to all of you and welcome to DAM's Ultimate Life Course. So we'll be discussing triangles of the neck today. Okay, should we start? Fine, I'm Dr. Pradeep Pawar and we'll be discussing this topic of triangles of the neck. Okay, I'll start. See this now. Now, this is the mastoid process. Yes, identify this muscle here. A muscle which begins from the clavicle, begins from the manubrium sterni, gets inserted on the mastoid process. Yes, what is this? Sternocleidomastoid, right? So this is sternocleidomastoid. This muscle, trapezius, that's the body and that's the ramus of the mandible. Body and ramus. This is the midline of the neck, and this is the clavicle. So understand this. This is the midline of the neck here. This muscle, that's the sternocleidomastoid. This is the trapezius. And now we draw a line from the angle to the mastoid process. An imaginary line drawn from the angle to the mastoid process divides the neck. This is the side of the neck now. Okay, this is the side of neck. And this neck is divided into two triangles by this muscle. What is this? Sternocleidomastoid. So sternocleidomastoid divides the neck into two triangles. This is the anterior triangle and that's the posterior triangle. Right. Now you tell me, what is this bone here in the midline? This is the hyoid bone, hyoid. And what is this muscle here which is inserted on the hyoid bone, which is attached to the hyoid bone? Yes. And which is attached to the scapula, to the superior border of scapula. What is this muscle? This is the omohyoid. Everyone is able to see this, no? This is the omohyoid muscle, omohyoid, right? So what is this belly of omohyoid? Superior belly. And this is the inferior belly of omohyoid. Omohyoid, right? Superior belly, inferior belly. Now this inferior belly of omohyoid divides this posterior triangle into further two triangles. What do you call this as? This is the occipital triangle, and this triangle is just above the clavicle. So what do you call this as? This is the supraclavicular triangle, supraclavicular. So the inferior belly of omohyoid divides the posterior triangle into further two triangles. This is the occipital triangle and this is the supraclavicular triangle. Getting this, all of you? Yes? Now there's one more muscle who has got two bellies. If you can identify this for me, a muscle which has got two bellies here. Yes, what is this? Identify this. Yes, and this is the other belly. A muscle having two bellies. Yes, what do you call this muscle as? Yes, digastric, right? So this is the digastric muscle. This is the anterior belly of digastric and this becomes the posterior belly of digastric. Now, the anterior triangle is further divided into many small triangles by this digastric and the omohyoid muscle. Clear? Now, just have a look at this. What is this triangle? I'll just enumerate this before we go into the details. Look at this triangle, this one, this triangle. What are the boundaries of this triangle? This is the midline of the neck, This is the superior belly of omohyoid and this is the sternocleidomastoid. So this is a triangle. This is a part of anterior triangle. And what are the boundaries of this triangle? Anteriorly is the midline of the neck. This is the superior belly of omohyoid and this is the sternocleidomastoid. In this triangle, we get only muscles, muscles and muscles. And these muscles look like a belt, right? Belt. These are therefore known as what? The strap muscles, strap muscles. All these muscles are below the hyoid bone. They are below the hyoid bone. So what do you call them as? The infrahyoid muscles. Infrahyoid. So this triangle contains only muscles, muscles and muscles, and this triangle is therefore known as the muscular triangle. Muscular. Clear? So clear with the boundaries of muscular triangle and clear with this contents we'll see later. So this is the muscular triangle. I'll label this for you. Just wait. Now see this triangle. What is this here? This is the sternocleidomastoid. What is this? This is the superior belly of omohyoid, and this is the posterior belly of digastric. Now in this triangle, what happens? What happens in this triangle? The common carotid artery comes here and divides into two terminal branches, the external carotid and internal carotid. And the external carotid gives branches to supply the head and neck. So this triangle is therefore known as the carotid triangle. Carotid, right? So what are the boundaries of this carotid triangle? This is the sternocleidomastoid. That's the posterior belly of digastric, and this is the superior belly of omohyoid. This is what we call as the carotid triangle. Clear to all of you? Following this? Very good. What is this triangle? Have a look at this now. This is the anterior belly of digastric. That's the posterior belly of digastric, and this is the body of the mandible. In this triangle, here it's something like this here, and this is what we call as the digastric triangle. Digastric. Okay, and we get a gland here. This is the digastric. And yes, what is this gland found here? This is the submandibular gland. Submandibular gland. Yes, very good. Topic is triangles of the neck. Okay, which subject? This is anatomy. Triangle of the neck. So this is the digastric triangle. Clear to all of you? And just one last thing. Just one small triangle left here. Look, this is the midline of the neck, midline. This is the anterior belly of digastric, and this is the hyoid bone, and this is a small triangle. This is half a triangle, okay? Half a triangle found below the chin. So what do you call this as? The submental triangle. Submental triangle. Are you clear about this? So that's a submental triangle. This labelings are clear. This is sternocleidomastoid. This is the trapezius. This is the midline of the neck. Midline of the neck. Okay. So this is the occipital triangle, and this is the supraclavicular. Supraclavicular. So you got an outline about the triangles of the neck. Okay. So just see the slide. Then we go into the posterior triangle of the neck. I'll just tell you the posterior triangle of the neck because that's very important, and a lot of clinical based MCQs on this posterior triangle of the neck. Okay. Have a look at the slide. I'll proceed now. Following now, all of you? Yes? Okay. Right. Clear till here? Any doubts? Anyone has till here? Okay, great. So now see the slide and just try to identify this muscles here in this slide. Okay, now this is of the opposite side, but you should get an idea now. Have a look at this slide. So let's start. What is this muscle now? This is the sternocleidomastoid, right? That's the sternocleidomastoid. What would this muscle be? This is the trapezius. This is the midline of the neck. Midline of the neck. Okay, and that's the clavicle here. Clavicle, right? So this is the posterior triangle, and this would be the anterior triangle. Anterior. Fine. Now, what is this muscle? Have a look at this. What is this muscle? This is the omohyoid. Omohyoid. This muscle is the omohyoid. And what is this muscle? This is the digastric. Digastric. What is this belly? Anterior belly, and that's the posterior belly of digastric. Okay, anterior and posterior belly. So what is this triangle now? This is the occipital triangle. This is a small, he has drawn a very small supraclavicular triangle, supraclavicular. What is this triangle? Have a look at this. This, you can see muscles here, muscles, muscles, muscles. This is what we call as the muscular triangle. What is this triangle here? This is the carotid triangle, carotid. What is this triangle here? This is the digastric triangle, digastric. And you get a small triangle here. What is this? This is the submental triangle, submental. This is clear to all of you? Okay, so that's about the triangles of the neck. I'll just tell you the posterior triangle in slight details. Posterior triangle. Now that you know the boundaries of this triangle, so what are the boundaries of posterior triangle? Have a look at this slide. Yes, so boundaries of posterior triangle, anteriorly is the sternocleidomastoid here, posteriorly is the trapezius, and below is the clavicle. Below is the clavicle. Okay, now we'll see the floor of the posterior triangle. Just one moment, I'll clear this for you. So the posterior triangle will have a floor, and posterior triangle is very important clinically also. There are plenty of MCQs on this posterior triangle of the neck. Okay, that's a sternocleidomastoid which I've drawn once again for you. Okay, coming to the floor of the posterior triangle, floor. Now floor of the posterior triangle is formed by the muscles. Muscles, now which are these muscles? Look, a muscle which begins from the vertebrae, from the cervical vertebrae and goes up to the caput. Capitus. This muscle is known as the semispinalis capitis. Semispinalis capitis. But I'll label this for you. Just wait. Semispinalis capitis. The next muscle. Okay, very good. The next muscle here, like this, I'll draw this for you. This muscle is known as the Splenius Capitis. Again, starts from the vertebral column to the caput. Splenius Capitis. So this is the semispinalis capitis. This is the Splenius Capitis. Now I am directly telling you this. The third muscle here, this third muscle is going to elevate the scapula. It's a levator of the scapula. What do we call this as? The levator scapulae. Levator scapulae. And now we've got three muscles by the name of scaleni. Scaleni. Look, this is one scaleni and this is the second scaleni. Okay, so this is the scalenus posterior. This is the scalenus medius. And first we used to consider scalenus anterior also in the floor of the posterior triangle. But now recent editions of Gray do not include scalenus anterior, because what he says that scalenus anterior lies behind the sternocleidomastoid here. So now we do not include the scalenus anterior in the floor of posterior triangle. Okay, we do not include scalenus anterior in the floor. So floor of posterior triangle would be formed by what? Yes, from above downwards. The first muscle is the semispinalis capitis. The second muscle is the Splenius Capitis. The third is the levator scapulae, the scalenus posterior and scalenus medius. Following? So these muscles will lie in the floor of the posterior triangle. And you know, all these muscles, they're lying in front of the vertebrae. They're lying in front of the cervical vertebrae. So all these muscles are therefore known as what? What do you say them? What do you call them as? They lie around the cervical vertebrae, in front of the cervical vertebrae. We call them as the pre-vertebral muscles. Very good. These are known as the pre-vertebral muscles. And all these pre-vertebral muscles will be covered by a fascia. What is that fascia? Easy. The pre-vertebral fascia. Okay. So all these muscles will be covered by the pre-vertebral fascia. So if these muscles are lying in the floor of the posterior triangle, and if the pre-vertebral fascia is going to cover these muscles, so now you tell me, where would the pre-vertebral fascia be for the posterior triangle? You getting this? You got my question? Look, my question is, these muscles are lying in the floor, right? And all these muscles are covered by pre-vertebral fascia, right? So where would pre-vertebral fascia come to lie with respect to the posterior triangle? That's my question. Answer this. Answer this. This is a demo class for Dance Ultimate Live course. This is a demo class. This is not T&D. Okay. So tell me, where would this lie? Where would this pre-vertebral fascia lie for the posterior triangle? It would lie in the floor. You're getting this? These muscles are in the floor and these muscles are covered by pre-vertebral fascia. So automatically the pre-vertebral fascia would come to lie in the floor of the posterior triangle. Roof, nahi, it's not roof. It's the floor of posterior triangle. Roof is something different. I'll show you the slide. So this pre-vertebral fascia would lie in the floor of the posterior triangle. You're clear to all of you? Okay. Look, I'll just make a slide for you. I'll make a slide for you. Just one moment. See, your concept will be clear then. Okay. Now I make it like this. Just have a look at this. See, these are the cervical vertebrae. These are the cervical vertebrae. It's in the floor, not in the roof. This is the first rib. That's the first rib. The first rib has got a small tubercle here. What is the name of that tubercle? Scalene tubercle. Scalene tubercle. Okay. Now that's the manubrium sterni. That's the body of the sternum. This is the clavicle here. This is the scapula here from behind. And that's the humerus here. Okay, now this area is the axilla. That's the axilla. Fine. Now just have a look. I'm just giving an orientation. It's a small demo topic for you. Okay, now have a look. Now what is this muscle which begins from the cervical vertebrae and comes and gets inserted on the first rib on the tubercle here, scalene tubercle? What is this muscle? This is the scalenus anterior. Scalenus anterior. A muscle which begins from the cervical vertebrae and gets attached to the first rib on a posterior aspect. What is this? Scalenus medius. Scalenus medius. A muscle which begins from the cervical vertebrae and gets attached to the second rib. This is the scalenus posterior. Scalenus posterior. I'm not drawing the second rib. Okay. So that's scalenus medius. That's scalenus posterior. Now we go up in a sequence. I'm drawing the floor of the posterior triangle, but in a different view now. This is the levator scapulae. Levator scapulae coming up. What is this? Splenius Capitis. And this is the semispinalis capitis. Semispinalis capitis. Look, who's this? Yes, that's the trapezius muscle. And look who's this. This is the sternocleidomastoid. Now you're getting what I'm telling you. So what have I drawn for you? I've drawn the floor of the posterior triangle. The same slide I've drawn, but in an anterior view. You're looking from front, and that's the floor of the posterior triangle from front. You're getting this now. So the floor of the posterior triangle would be formed from above downwards by semispinalis capitis, the splenius capitis, the levator scapulae, scalenus posterior and scalenus medius, and all these muscles would be covered by the pre-vertebral fascia, and that's how the pre-vertebral fascia comes to lie in the floor of the posterior triangle. Am I clear to all of you? Fine. Okay, that's good. Very good. I'll show you the cadaveric image. Now you tell me, what is this here? Now see, what's this? Behind the manubrium, what's this? That's the arch of aorta, right? That's the arch of aorta behind the manubrium. And what's this? This is the subclavian artery. Look at this. And the moment the subclavian artery crosses the first rib, it is now known as what? Axillary artery. This is now known as axillary artery, and the axillary artery now comes into the axilla. Something else here. This is C5, C6, C7, C8 and T1. And what's that? That's the brachial plexus. And that's how the brachial plexus comes down into the axilla. So where would this brachial plexus and subclavian artery, what would they be for the posterior triangle? What would they form for the posterior triangle? Contents. Very good. That's contents of the posterior triangle. So this brachial plexus and the subclavian artery is going to be the content of the posterior triangle. You understanding this? Yes, so now we discuss the contents of the posterior triangle. Contents of the posterior triangle would be, yes. So floor is clear to all of you, no? So next, coming to the next would be contents of the posterior triangle. Contents would be 1, the subclavian artery. The second is the brachial plexus. Yes, brachial plexus. And now understand this. Look, this is a nerve. And this is a nerve. I'm drawing this in yellow. This is a nerve which is lying on the Levator Scapulae. Yes. Identify this. If anyone can identify this nerve for me. This nerve lies on the Levator Scapulae. Chalo, answer this. This nerve lies on the Levator Scapulae. What is this nerve? Yes. Look. I'll tell you like this. This nerve first supplies the sternocleidomastoid. This nerve first supplies the sternocleidomastoid, then comes in the posterior triangle of the neck. Now lies on which muscle? Levator Scapulae. And what is it going to supply? The trapezius. So this nerve lies, first supplies the sternocleidomastoid, comes in the posterior triangle, lies on the Levator Scapulae, and now goes to supply the trapezius. Very right, very good. And this is the spinal accessory nerve. And this is the most important content of the posterior triangle. Understand this. Why is this most important content? Because in this posterior triangle of the neck, we get large number of lymph nodes. This is a clinical question, very important. In this posterior triangle, we get large number of lymph nodes, and this lymph nodes becomes matted in, yes, they become matted in tuberculosis. They get matted in tuberculosis. Now, this spinal accessory nerve is very superficial. It's very, very superficial. It gets caught, entangled into this lymph nodes, right? Now, we are doing a lymph node biopsy, or we're doing a excision or biopsy. And accidentally, while doing this, this accessory nerve gets damaged. Now tell me, damage to the spinal accessory nerve in the posterior triangle of the neck would lead to paralysis of which muscle? Following this? Yes. Any MCQ on posterior triangle of the neck, your first focus should be on spinal accessory nerve. If this nerve is damaged in the posterior triangle, which muscle would be paralyzed? Tell me. Answer this. Which muscle is this? Which muscle will be paralyzed? This is a demo class. Once again, this is a demo class for dance ultimate live course. T&D I think will be from 5 o'clock, I suppose. From 6 o'clock. I don't know. But this is a demo class for dance ultimate live course. Yes. Chalo bolo. So which muscle would be paralyzed? Trapezius as well as sternocleidomastoid? Yes, what do you say? Trapezius as well as sternocleidomastoid, or only trapezius, or only sternocleidomastoid? Yes, what do you say? Yes, it's only trapezius. Only trapezius would be paralyzed. You're getting this because if we cut this nerve in the posterior triangle of the neck, sternocleidomastoid has been already supplied. No, the nerve first supplies the sternocleidomastoid and then comes in the posterior triangle. So if this nerve is damaged in the posterior triangle, muscle spared is sternocleidomastoid, muscle affected is trapezius. You're following this? Very good. So what will the person come to you? You are a clinician sitting in your clinic. The person will come. What will the person complain of? The person will immediate complaint would be difficulty in shrugging of shoulders, right? Difficulty in shrugging of shoulders. Difficulty in overhead abduction. Who does this overhead abduction? The serratus anterior and trapezius. So the person will complain of difficulty in overhead abduction, and there would be winging of scapula at rest. Winging of scapula at rest. I'm just putting this directly. So muscles paralyzed would not be sternocleidomastoid and trapezius. Mrudul, understanding? Yes. Yes, and it would be only trapezius. You got this? Because the nerve first supplies the sternocleidomastoid and then comes in the posterior triangle. So muscle affected would be trapezius. Immediate complaint of the person would be difficulty in shrugging of shoulders. Second, difficulty in overhead abduction. And third, there would be winging of scapula at rest. At rest meaning if the person is just keeping his arms like this and still there's a winging of scapula, this is winging of scapula at rest due to paralysis of trapezius. And if a person is attempting a movement, attempting meaning a person is performing a movement, he's pushing or he's punching and then he gets a winging, this is paralysis of serratus anterior. Understanding this? So paralysis, winging on attempting movement, serratus anterior, winging at rest, trapezius. Following this, so the most important content of the posterior triangle is spinal accessory nerve. What else? One is the brachial plexus, second is the subclavian artery, brachial plexus and subclavian artery. And what I want you to understand is, just understand one thing, all these muscles are covered by what? Pre-vertebral fascia. Fine, all these muscles are covered by pre-vertebral fascia, and this brachial plexus and subclavian artery has to pierce this pre-vertebral fascia and come out. You're following this? The brachial plexus and subclavian artery are lying between the scalenus anterior and medius, and they have to pierce this pre-vertebral fascia and get out. And as they pierce this pre-vertebral fascia, the same pre-vertebral fascia, look, the same pre-vertebral fascia will enclose them, and the same pre-vertebral fascia would be now carried in the axilla. If you see in the axilla, the axillary artery and the brachial plexus are put in a sheath. And what is this sheath known as? The axillary sheath. You understand? That means what I want you to understand is the axillary sheath is derived from, it's an extension of, your answer, pre-vertebral fascia. This is what I want you to know. So axillary sheath is nothing but the continuation of the pre-vertebral fascia which goes into the axilla along with the brachial plexus and now the axillary artery. Am I clear? This should be crystal clear. This is very important for you. Okay, so anything else? Yes, anything else? Any other content of the posterior triangle? Now, which are the other contents? There's one more. Now look, there's a plexus in the neck, a plexus, a group of nerves. And what is this plexus in the neck known as? The cervical plexus. Cervical plexus. And there are 4 branches of cervical plexus that we get here. Okay, which are the branches of cervical plexus which comes to lie in the floor of the posterior triangle? Just have a look at this. There are 4 nerves. There's a nerve which winds around the accessory. Look, this is so nice. It winds around the accessory and goes up to supply the occiput. These are cutaneous nerves. Okay, they will supply the skin. So this is a nerve which winds around the accessory and goes up to supply the skin over the occiput. Yes, what's the name of this? Very good. This is the lesser occipital nerve. Lesser occipital nerve. And this lesser occipital nerve is going to hook around. It's going to wind around the accessory nerve. Yes. There's another nerve which is going to supply the skin over the angle of the mandible. Yes, you can guess this. Which is this nerve? A branch of cervical plexus which is going to supply the skin over the angle of mandible. Guess this? Yes, guess this? Yes, this is the greater auricular nerve. Greater auricular nerve. If you must be knowing this, the entire face sensory supply. Yes, the entire face sensory supplies by what? The trigeminal nerve, except, yes, that's right, you got it, except a small area of the skin over the angle of mandible, and this is supplied by the greater auricular nerve, and this greater auricular nerve is a branch of the cervical plexus. Got this? Yes, so what are the branches of cervical plexus? One is lesser occipital, second is greater auricular, the third one goes transversely in the neck. What do you call this as? Look, very simple, transverse cervical, and it supplies the skin, cutaneous, transverse cervical cutaneous. Okay, it goes transversely in the neck, it supplies the skin here, it's transverse cervical cutaneous. And the last nerve goes down to supply the skin. Yes, it's above the clavicle, and this is what we call as the supraclavicular nerve. Supraclavicular nerve. Supraclavicular. So these are the branches of cervical plexus. Okay. This is the spinal accessory nerve. So these are the branches of cervical plexus. What is that? Lesser occipital, greater auricular, lesser occipital, greater auricular, the transverse cervical cutaneous, and the supraclavicular nerve. So this becomes the contents of the posterior triangle, and all these nerves are cutaneous. They will therefore come and also line the roof because they have to supply the skin. So these nerves would be a content. These nerves would also come to lie in the roof of the posterior triangle. Okay, roof. So to summarize, once again, quickly have a look at this slide. Here, look at this dissected specimen. What are seen? One moment, I'll just finish this. Look at this. slide first. He's not drawn this nerve here. What was this nerve which is not shown here? That's the spinal accessory nerve. What's that? The lesser occipital. That's the greater auricular. That's the transverse cervical. And this is the supraclavicular nerve. Supraclavicular nerve. You got this? So this becomes the branches of cervical plexus which lie in the posterior triangle. Look at this. This is the omohyoid. That's the superior belly and that's the inferior belly of omohyoid. And this, all this that you're seeing would be the floor of the posterior triangle. Floor of the posterior triangle. And this is the brachial plexus. Look at this. This is the brachial plexus and this would be the subclavian artery here. Brachial plexus and the subclavian artery. Okay, just the relevant things I'm showing you. Now tell me, what are we left with? What are we left with now? I've told you the boundaries of posterior triangle. I've told you the floor of the posterior triangle. I've told you the contents. So now what is left is the roof of the posterior triangle. Roof. Look at this. This is a section through the neck. Okay, a section taken through the neck. So this is anterior and that's posterior. Fine. Now identify this muscle. What is this muscle? Sternocleidomastoid. What is this muscle? Trapezius. This is the trapezius muscle. Okay. Now tell me, if this is sternocleidomastoid and that is trapezius, what is this area? What is this area? That's the posterior triangle. You're getting this? And ye hai midline. This is the midline of the neck. So what is this area? Anterior triangle. So that's it. This is a section through the neck. That's the trapezius. That's the sternocleidomastoid. So this is the posterior triangle of the neck. That's the midline. So that has to be the anterior triangle. And look at this. What are all these muscles? These are the muscles which we have just drawn, and these are the muscles which lie around the vertebrae. Yes, these are the pre-vertebral muscles, and this pre-vertebral muscles will lie where? In the floor of the posterior triangle. And look, this is so nice. What is this orange thing? What is this orange thing? Guess this fast. Come on. This is the pre-vertebral fascia, and this is what I was telling you. You're clear now? So this pre-vertebral fascia would lie in the floor of the posterior triangle. Absolutely clear this is. And now what would lie in the roof of the posterior triangle? There's another fascia. And what is the name of this fascia? This is the investing layer of the deep cervical fascia, and this investing layer would begin from the spines of the cervical vertebrae and it would come in the midline here. That red colored is the investing layer of the deep cervical fascia. Now this investing layer starts from the vertebrae, from the spines of the cervical vertebrae, comes laterally, gets this muscle now. What's that? Trapezius. It splits, encloses the trapezius. Look how nice. It encloses the trapezius here. Now joins at the anterior border of the trapezius, and it is now going anterior. What is it going to form? What is it going to do now? It is going to form the roof of the posterior triangle. Look at this. So roof of the posterior triangle would be formed by the investing layer of the deep cervical fascia. It comes in front, gets this muscle sternocleidomastoid, it again splits, encloses the sternocleidomastoid, and comes, it will form the roof of the anterior triangle, and it would join with the fascia of the opposite side in the midline. Okay, so this fascia starts from the cervical vertebrae, comes in the midline here. It encloses two muscles, the trapezius and the sternocleidomastoid. It forms the roof for two triangles, the posterior as well as the anterior triangle. Okay, that's about the posterior triangle of the neck. Am I clear to all of you? Enjoyed the session? Anatomy is very nice and very interesting. Okay, you just have to understand your concepts. Okay, just 10 more minutes I have for this demo class. Okay, have a look at this MCQ. Now with respect to this posterior triangle of the neck, just answer this MCQ. Following are the superficial branches of cervical plexus. Yes, so I've just told you the superficial branches of cervical plexus. So what is the answer for this? Except. Greater auricular, yes. Greater auricular is a branch, yes. Supraclavicular, yes. Transverse cervical. Greater occipital is wrong. Greater occipital is not a branch of cervical plexus. Okay, right. Yo, look at this. Axillary sheath is derived from. I told you, axillary sheath. Axillary sheath Axillary sheath is a continuation of what? The pre-vertebral fascia. The same pre-vertebral fascia comes down into the axilla. It is now known as the axillary sheath, right? So it is derived from pre-vertebral fascia. Now just see this. This is how the questions are going to be for you now. Yes, look at this clinical MCQ. Look at this clinical MCQ. And answer this. Yes, what do you say? This answer for this? Yes, very good. All of you are very nice. Chalo, you're answering well. Very good. You understood everything. So look at this clinical question. 43 years woman came with a large abscess in the middle of the posterior triangle of the neck. The physician incised and drained the abscess. 5 years later, she could not extend her right hand above her head to brush her hair. That means overhead abduction is lost. Yes, you got this. Very good. What's the answer for this? Cut to the spinal accessory nerve. Cut to the spinal accessory nerve. Again, I'm telling you, any MCQ on the posterior triangle of the neck, your first focus should be spinal accessory nerve. Whether it's an incision and drainage, whether it's a lymph node biopsy, the nerve damaged would be the spinal accessory nerve. The immediate complaint, difficulty in shrugging. Second, difficulty in overhead abduction. And third, winging of scapula at rest. Okay. And winging on attempting movement is serratus anterior. Yes, any doubts in this? Any doubts you have? So this was a small demo topic just to make you understand how we teach in dance. Okay. So I'm associated with DAMS since last 12 to 13 years. I've been teaching for DAMS all the regular course, the test and discussions. Right, so come enroll with us. Like, this is my referral code DRPR MED 394. If you're joining, you can quote this referral code at the time of joining. I'm Dr. Pradeep Pawar. Yes, it would damage only the trapezius, not the serratus anterior. Contents of the digastric triangle is submandibular gland. Submandibular gland. That way triangles are very big to explain. Later in some lecture I'll explain the rest of the triangles. Okay, the most important thing was this posterior triangle of the neck. So I just wanted you to understand the posterior triangle of the neck first. So later as we proceed into the course, we'll be discussing everything. Okay, any doubts you have, you ask. I still have got 5 minutes. I'm from Mumbai, Maharashtra. This I told you, no? Okay, clear to all of you? Boundaries of the posterior triangle is sternocleidomastoid, trapezius, and anterior triangle. Ansa cervicalis is there, which is very important. Ansa cervicalis. Okay. So that's about the posterior triangle of the neck. A small demo for you. I hope you've understood this. You've enjoyed this. Okay. Thank you. Thank you.